Hello, everyone, and welcome to This Week in Hearing. It's my pleasure to have on the program Bridget Dobyan, Executive Director of the Hearing Industries Association, or HIA. Previously, she was HIA's Director of Public Policy and Advocacy. It's the topic of public policy that brings Bridget to the show today. But before we get into that, Bridget, please tell everyone a bit more about your background and both your roles at HIA.
Sure. Andy, it's great to be here with you today. As you noted, I'm the new executive director of HIA. I've been serving in this position since January of this year. Prior to that, I was HIA's director of public policy and advocacy for nearly 4 years. So my path to HIA was kind of a winding one. I'm actually a lawyer by training. I briefly flirted with the idea of corporate law, but made the right decision after law school to stick with policy. I worked as a policy advisor for the Michigan Senate for a couple of years. I made the jump from there to DC, where I served as legislative director for Michigan Congressman Dave Trott. Following his retirement, I made the decision to leave Capitol Hill. It was a difficult one to go, but I think the right one, because I went on to serve in government affairs for an energy efficiency nonprofit before ultimately coming to HIA. So that winding path has given me a background in law, state and federal policy, and of course, nonprofit advocacy. So, what's really funny is that in my initial conversations before joining HIA, no one actually knew that I had hearing loss. I lost hearing on one side when I was 11. I am a very satisfied user of a bone anchored hearing aid. And so I think that personal connection is really incredibly valuable when advocating for the importance of hearing health, when working to combat the stigma around hearing loss. And so I'm just so thrilled that my professional pathway has brought me here, and I'm really honored to lead HIA.
Which is a really interesting background in multiple respects. I mean, in terms of hearing loss, you came at it in a way that I've seen other times before, where a person has hearing loss and they manage to work their way into the industry, whereas I was the opposite case. I was in the industry for 6 or 7 years before I finally addressed my hearing loss, a result of a youth going to too many rock bars and otherwise abusing their ears, and it finally caught up with me. But also all your experience on the Hill must really benefit HIA in multiple ways. So it seems like a great place to land.
I would say so. And, I wish that the cause of my hearing loss was something as fun as going to too many rock concerts, but I'm sure at some point maybe that'll catch up with me too, but that's another discussion, right?
That's a totally different discussion. At least you don't look yourself in the mirror and blame yourself. But anyway, since we came to talk about public policy, let's get into the conversation. And actually, I think the policy initiative with the highest potential impact right now is the Medicare Audiology Access Improvement Act, or MAAIA. I should probably explain for a global audience that Medicare is the U.S. government program that provides healthcare benefits and services for people age 65 and older. Would you explain how hearing care services are provided by Medicare today and what changes are proposed in MAAIA?
Sure. So, hearing care services are somewhat limited under what I'll call original or traditional Medicare. You have original or traditional Medicare, and then you have Medicare Advantage, which is Part C. So, original Medicare has Parts A and B, so your hospital, your inpatient services, your diagnostic. There is a statutory exclusion within the Medicare program currently, the original Medicare program, that hearing aids cannot be covered under original Medicare. However, certain diagnostic services relating to hearing health are covered, as well as things like osteo integrated devices and cochlear implants for beneficiaries who fit certain selection criteria. So again, nothing for what we would call traditional hearing aids or prescription hearing aids, but osteo and CI and certain diagnostic and vestibular services. So the MAAIA bill, which DC is a town of acronyms, and thank goodness, because that's a mouthful. So happy to refer to that one as MAAIA. HIA is very pleased to endorse this legislation. It's been introduced in multiple sessions of Congress so far, and it's a priority for the audiology professional groups. So just a brief overview. The MAAIA bill would provide Medicare coverage for diagnostic and treatment services that are provided by audiologists. It would remove the physician order requirement to improve access to audiologists and also reclassify audiologists as practitioners under the Medicare program. The bill does not expand the scope of services that are currently covered under original Medicare. It just kind of smooths that pathway to covered audiology services, nor does it expand the scope of services provided by audiologists. And I will give ADA a shout out on that summary because I did pull that one from their website. It's very eloquently put. So this bill has been introduced in both the House and the Senate. It's a bipartisan bicameral bill. It's S 2377 in the Senate, which is led by Senators Elizabeth Warren, Rand Paul, and Chuck Grassley. And then in the House, HR 6445, it's led by Gus Bilirakis and Matt Cartwright.
And I've seen various groups going to Congress to lobby for this bill. What can ordinary people or people in the hearing industry as individuals do to help move this across the finish line?
Well, I think for your ordinary individuals, the best thing that you can do is reach out to your members of Congress, reach out to your senators. You can, of course, reach out in writing, but I have always said that the best way for a legislator to take specific interest in an issue is to see how impactful that issue is. So invite your congressional member, invite their district staff. If you're a professional, invite them to your office. Have them come in, see what you do. Check their ears, discuss what your day usually looks like, the population that you serve. I think that firsthand experience in witnessing what professionals do is the most important. And then, as your ordinary person who might have hearing loss or hearing difficulty, again, call your congressional member, call your senator. They work for you. And voice the importance of access to hearing health services, particularly for Medicare beneficiaries.
Okay, thanks. Now, one thing that's not in MAAIA, and you mentioned this too, is that hearing aids themselves are not covered by Medicare, and it's not in a MAAIA bill either, but it has shown up several other times in proposed legislation. Share where that's at and how HIA views those proposals, please.
So in this particular Congress, actually, let me back up a little bit. In the last several Congresses, there are always a handful of bills that are introduced and then reintroduced that deal with the statutory exclusion of hearing aids in the Medicare program a bit differently. For example, Congresswoman Debbie Dingell has a bill that she's introduced in multiple Congresses that would remove that statutory exclusion, which would then pave the way for the regulatory authorities to create the rules to allow for coverage. We may recall that in the previous Congress, the 117th Congress, there was the Build Back Better Act that failed to pass by a very narrow margin, a margin of Senator Joe Manchin, that would have expanded Medicare to include coverage for hearing aids and related services. And then there are a handful of other bills in between that all take kind of a different approach to the coverage issue. In this particular Congress, it's a divided Congress where Democrats control the Senate, Republicans control the House, and of course, we have a Democrat in the presidency. With a divided Congress, that makes it difficult to make any really significant or seismic changes, particularly in something that is as big of an issue as potential Medicare expansion. And the Medicare expansion conversation doesn't just pertain to hearing aids. It typically includes dental, vision. So hearing, dental, vision, none of those three are currently included, again, within the original Medicare program. And again, it's very important to make that distinction, as nearly all Medicare Advantage plans offer some type of supplemental benefit within the hearing health space, dental space, and vision space. So for purposes of this Congress, we have not seen a large-scale proposal such as Build Back Better. And really, in this Congress, at this point, there's not a lot of large legislative packages that are going to move forward at all. Not to change topics at all, but we are in an election season, and typically an election season at the congressional level tends to create a bit of a vacuum for legislative activity, particularly in the second half of the legislative session. And we are in not just an election season, but a presidential election season. So not just a vacuum for legislative activity, but kind of a black hole for legislative activity, particularly at this point. So, we do still see members of Congress taking an interest in, the oversight of these programs and asking the questions. With Medicare Advantage, we know that there are questions about utilization rates and how to collect the best data on the success of the Medicare Advantage program if beneficiaries are utilizing their supplemental benefits. And so, while I don't see a lot of activity at the legislative level, it is an opportunity for a bit more action in the regulatory space, which would really speak to that data collection, utilization metrics, and overall satisfaction and operation of these programs.
Okay, so it sounds like that's almost a precursor step to some legislation because you then have the evidence and the data behind it. And I suppose it's fair to say that the Build Back Better bill was a much larger bill. And so the reason for it not passing doesn't necessarily have to do with the Medicare hearing, dental, and vision coverage, but the greater issues that were around Build Back Better. But, and I'll ask how you feel about this because my personal opinion is roughly half or a little more of people are taking advantage of the Medicare Advantage programs now, but that also creates an accessibility gap, leaving behind hearing coverage for those who can't afford an Advantage program. And how do you feel about that?
Yeah, HI is very supportive of access and affordability. And in crafting these legislative proposals, it's really important to make sure that it's done the correct way that does ultimately provide a benefit to the beneficiary, making sure that there would be enough providers, that the benefit is structured in a way that individuals can access the devices that are best suited for their unique hearing loss, for their lifestyles. And so, it's a very detail-oriented conversation that needs to be had within restructuring the Medicare program.
Yeah, that makes a lot of sense. And of course, Medicare is for people 65 and older. For younger people, unless I'm missing something, Congress has generally shied away from mandating private insurance coverage of hearing devices and services, typically leaving that to the states if the states choose to do so individually. But that's not true for cochlear implants and bone anchor devices. There's now the proposed bill called Ellie's Act. Share how and why that made it onto the federal agenda.
Yeah, so this is really a passion project that has grown. This was started by Melissa Tumblin, who runs Ear Community, which focuses on hearing loss related to microtia and atresia. And she was spurred on by her daughter's experience in trying to obtain an osteo-integrated device due to her medical conditions and having difficulty doing so. And so Melissa worked with Representative Joe Neguse out of Colorado to introduce the House version of the bill. Again, this is another one that's been introduced in multiple Congresses. There's a Senate companion that is led by Senator Shelley Moore Capito of West Virginia and Elizabeth Warren as well. And so this device, again, this bill, it focuses on osteo devices and on cochlear implants and trying to smooth that access pathway within the private health insurance space to obtain these devices for a population, for which these devices are really the only option.
Another hot topic is the 2021 decision of the U.S. Preventive Services Task Force to not recommend hearing screenings as part of routine examinations for people 50 and older. This caused a good deal of consternation in hearing care circles, especially since the deleterious effects of untreated hearing loss seem well understood. But the task force, which makes evidence-based recommendations, stated that, and I'm quoting here, whether earlier detection due to screening and provision of amplification improves outcomes is not clear based on existing evidence. Let's break that down. How did they come to that conclusion, and what would be needed to change that decision?
So I'll cite specifically to the comments that HIA submitted in response before the recommendation was ultimately finalized. And our comments recognize that need for more specific evidence and peer-reviewed research to support a recommendation. And we really focus that down in three different areas: studies on protocols, studies on procedures, and studies on efficacy. And at this point, we generally rely on our excellent, excellent network of strategic advisors, including Dr. Tom Powers, who can speak very eloquently and thoroughly to the specifics of each of those three elements. At the overarching policy level, anytime that a recommendation is made or legislation advances or, regulatory measure is adopted, it really is founded and grounded in science, in research, and in review. And we've had follow-up conversations with NIDCD, had follow-up conversations with congressional members about the importance of addressing hearing loss, of screening for it, and intervening early, and the associated comorbidities, and then the overall health and well-being outcomes, the positive health and well-beings from an earlier intervention. This is also an ongoing conversation with our partners, the audiology groups, hearing aid specialist groups, consumer advocacy groups as well, around the importance of screening. So the U.S. Preventive Services Task Force, which again, DC being a city of acronyms, the USPSTF, as it rolls right off the tongue, that's one part of the process. The other part of the process is now working to supplement that screening research that they said is lacking. And so this is something that, we've been working on. There is more work to do about what that research looks like, where it's most appropriately conducted, and, if there's anything that's currently ongoing within the National Institutes of Health. And so we've worked with congressional members to have this issue recognized at the congressional level within appropriations report language that asks about what's currently going on. And so then the next step is kind of filling in those gaps before USPSTF will and can revisit the screening issue. So the best answer is it's an ongoing issue that we continue to emphasize and recognize its importance.
Okay. And it strikes me, the physician workload always comes to mind. And so if you're going to add workload in a medical practice during a routine exam, you really have to have clear evidence that the outcome is going to be beneficial. It strikes me that once a screening protocol is developed, that has good evidence for being accurate and improving the outcome, that this could be highly automated these days with a little AI or machine learning, that you could have even a multi-step screening protocol that's more or less automated and reduce the physician workload, because you could set a person up at intake time and let that thing run and then interpret the results or have the results interpreted for you. Is that the sort of thing you envision happening in the end? And what kinds of things would be built into such a screening protocol that makes sense?
I think that's a really interesting perspective on the potential for automation, because you're right, there is a significant physician workload, particularly if you're looking at, an annual physical, how much time is spent with the patient and how are those short time resources allocated to be the most impactful for the end outcomes for the patient. I kind of latch on to this discussion of artificial intelligence too, because that's an area that we are seeing significantly greater focus from Congress and from regulatory authorities. For example, the FDA has created a new advisory committee, the Digital Health Advisory Committee. And that's taking a look at how FDA can both responsibly potentially regulate the artificial intelligence space, the digital patient, telehealth. It's a very broad mandate of this advisory committee, but I think a very important one. And you're right, all of these issues kind of loop back around to each other to, can we make the system more efficient and ultimately more beneficial to the patient? I don't have the perfect answer for how this might work and how it looks in the end. But what we are doing in the meantime is impressing upon the importance of early intervention of hearing health.
Okay. And of course, we've been having this conversation about, making decisions based on evidence. And one of the bits of data that's often used, both in decision making and framing policy goals, is the MarkeTrak reports. Let's discuss that a little bit more. What's going into the MarkeTrak? What are you going to do for the next one that's different than the previous ones? And what do you think is the most valuable contribution in the whole hearing space of the MarkeTrak reports?
Sure. So we are so excited that we'll have our next MarkeTrak. We'll be fielding it later this year with results expected in 2025. So this version of MarkeTrak will be termed MarkeTrak 2025 or MT25. MarkeTrak 2022, which as the number speaks to, was released in 2022. It sampled over 15,000 households. We reached nearly 44,000 individuals. With an ultimate 3,218 individuals with self reported hearing difficulty, with hearing aid owners representing just under 1,200 of that population. And so it's a big survey. We found that people in the hearing health community kind of excitedly anticipate the results. We have been really pleased that we've been able to host issues of seminars in hearing that discuss some of the findings in a peer-reviewed way. And we're excited to do that again with MarkeTrak 25. So we look forward to extending a lot of our longitudinal research. So some of those top line, which I think most listening to this podcast would be familiar with, would be the rates of self-reported hearing difficulty, age and gender breakdowns, average number of years that it takes to take each step in the hearing loss journey. Adoption rates, of course, overall device satisfaction, satisfaction with hearing professionals and the services that they offer, information on coverage. There is obviously a lot more in there, but MarkeTrak 25 will be the first survey in the OTC space. And so we're looking forward to this potential to obtain additional insight into OTC and into consumer behaviors and perceptions, and if they've shifted in the last couple of years in this new reality.
Yeah, that'll be really interesting to see because, we know the first year of OTC was a little bit lackluster compared to expectations. And even at the UHA last year, there was some discussion of that, a presentation that was done talking about that, but now we'll have enough time behind us and the industry itself has matured. So I think that's going to be really, really interesting to see what the public perception of OTC is. And if there's enough people using OTC devices in the survey, what their feedback is in the get-go. So I think that's going to be a valuable part of the next MarkeTrak.
I agree.
So as we wrap it up, I also want to acknowledge that HIA does a lot of education and advocacy work, which of course was part of your title previously, for example, with the Hear Well campaign. Do you want to add any detail on that initiative or others that HIA are taking in the education and advocacy sector?
I would love to. And I love wrapping this into the policy discussion that we're having, because I think it's really important that our policy informs our communications and our communications informs our policy. So, I referenced at the beginning of our conversation that there's a bit of a legislative vacuum that's expected for the rest of this year. So we certainly don't sit back and do nothing during that time. We take advantage of it as an opportunity to expand our education and awareness outreach efforts with members of Congress, with their staffs, and then pursuing opportunities for them to engage their constituents on the importance of hearing health. And so that's one piece of the Hear Well campaign, because this is an unbranded campaign. It was put together with our partners, again, the professional organizations, the consumer organizations, and it has created social media graphics, tiles. You can edit these different resources. We have videos, and I will give you a shout out, Andy, as one of our highest performing videos with the testimonial that you created for the Hear Well campaign. And so to be able to take those resources to congressional offices for them to share with constituents, and then for us to be able to speak directly to consumers, to speak to them on Facebook. HIA has expanded into Instagram this year. So we're working on increasing our outreach to people who are scrolling through their phone. And if they can take a second to realize, maybe I should think about my hearing health while they're scrolling, that's ultimately a positive. And then also working to engage professionals. How can these resources benefit them? Can they incorporate these resources into their office outreach, into their communications, into their Facebook groups? So what I'm most excited about with Hear Well, and it has, a great track record of success, is that we're excited for it to continue to evolve. We're undertaking some new efforts. So World Hearing Day this year, we actually created a hearing health quiz and saw some of our highest engagement. There were some fun questions. There were also some serious questions about hearing health, about hearing loss. Did you know that these celebrities have hearing loss or wear hearing aids? And so it's all part of combating that stigma around hearing loss and then making sure that people have the information when they make that choice to see a hearing professional or to take that first step to actually address their hearing health needs.
Oh, that's a really excellent part of the program. I love showing successful people who have hearing loss. It's not to remove the stigma by showing people living happy, successful lives while having hearing loss, I think is fantastic. So that's a great part of the program. And I was glad to contribute to it. I appreciate the shout out. I wasn't looking for it, but
It's a
I was,
well-deserved shout out.
oh, well, thanks. I mean, I was happy to contribute and I'd be happy to contribute again. Um, Now, as we kind of conclude, are there any other closing thoughts you have? And if people would like to reach out to you as a result of this conversation, how would they do it?
People should absolutely reach out to me. I am still quite new in the executive director leadership role, not new to the industry, not new to the community, but I am open to hearing from everyone. So the best way to reach me is by email. So my email is bdobyan, BDOBYAN @hearing.org. You can, of course, find that through our website as well. I think that really my closing thought is this is such a collaborative space. And to make change in hearing health, to make change in people's perceptions, and then ultimately to make that really positive change in people's lives, it takes all of us. And some of our messaging points might be a little bit different, but that's where the Hear Well campaign has been, so beneficial. Now we've been able to come together to create this resource, and so I'm excited for the future. I'm excited to bring HIA into this new space, and just really thrilled to be here and to be on this podcast with you.
Well, thanks. And I'm really happy that you joined. I thought this was a great discussion and I think everybody will appreciate it. So thanks to everybody for watching or listening to this edition of This Week in Hearing. And thank you too, Bridget.